cancer in our OPD, most of the patients will go for PET CT as well, just to accurately stage the disease. After all those battery of investigation, we will stage the disease. So this is empirically just a rough pictorial representation of the staging of breast cancer. Stage 1 is early breast cancer, which is the tumor confined to the breast, node negative. Stage 2 is again early disease. Tumor might have spread to the ipsilateral axillary lymph nodes. They have to be movable or mobile, node positive. And stage 3 is locally advanced, that is involvement of the chest wall, involvement of skin, or both, or the internal mammillary lymph nodes. Just roughly keeping the picture here. And stage 4 is advanced or metastatic disease, where the disease has spread to the distant organs in the form of liver mets, bone mets, brain mets, lung mets, etc. So the staging is important because the staging, based on the staging, the treatment changes significantly. Stage 1, stage 2 are considered as early stages for all practical purposes. Stage 3 is locally advanced disease. Stage 4 is advanced disease or metastatic disease, metastatic breast cancer. So when we have done the battery of investigations and staged the disease, next comes the important aspect is the treatment. So I would like to actually have a rationale, how do we go about, not in detail, but just. So whenever we see a breast cancer patients in OPD diagnosed, first question comes is, can we cure this lady? That's the important in terms of treatment decisions which we have to take. So if the lady or the patient diagnosed falls into early stage or sometimes locally advanced stage as well, so we think in terms of curative intent. Whereas if the disease is already in the advanced or stage 4 disease, most likely the treatment intent will become palliative. But when I tell palliative, it's just not for the palliation of pain or associated symptoms. We try to give a maximum possible disease control, if at all possible, cure. Why I am telling this is, if you look 20 years back ago, when we don't have targeted therapy agents or immunotherapy agents or olaparib or rucaparib, palbociclib, all these are the latest drugs which are available. If you look 20 years back ago, the 5-year overall survival for stage 4 cancer used to be roughly in the range of, if we can tell confidently, 10% to 20%. So that means if 100 patients are diagnosed with breast cancer in stage 4, I am talking. So in those days where we don't have the targeted therapies like trastuzumab, pertuzumab, TDM1, these are all the targeted therapies. When we don't have them in our hands or in kit, so the survivals were dismal for stage 4 disease. But after the introduction of all these novel agents, we can confidently tell that based on all these characteristic features of that particular patient, 5-year survivals for stage 4 breast cancer have reached to 50% to 60%. So that's definitely a big boon for the patient, breast cancer patients, with the availability of the novel agents. Yeah. So let us talk about the local therapy. Local therapy involves surgery and as well as radiation. So wherever feasible, we offer lumpectomy, that is breast conserving surgery. So we don't remove the whole breast. We just plan for the breast conserving surgery, that is only lumpectomy plus radiation. So the BCS plus radiation is called as BCT. So what is the importance is, again, if you talk about the same topic 15-20 years back ago, this was not so much evolved in the sense that they have to undergo mastectomy. So it is a very, disaster for the lady, definitely, any point of time. So, but the importance, what we should know and the phobia, what all patients even today, what they ask is lumpectomy inferior to mastectomy? I'll go ahead with mastectomy. So that's the practical challenge. But over a period of time, 10 to 15 years, research has shown that lumpectomy is non-inferior to the mastectomy in the sense that we achieve the same survival equivalent of mastectomy, and we give the cosmetically acceptable breast with reduced rates of local recurrence as well. That is the